Now, back pain can be more than just uncomfortable. It can stop you from doing the things that you love, affect your work, and change how you live your everyday life. But what if spine surgery could help you regain movement and return to the activities that you love? Welcome to Health Matters. I'm your host, Fiona, and today's episode is titled Back in Action, Restoring Mobility Through Motion Preservation Surgery. Now, as the title says, we will be exploring how modern spine surgery is transforming the way doctors treat back and neck conditions, helping patients stay active, recover faster, and move more naturally. Joining us today is Dr. Lim Sze Wei, a consultant orthopedic, trauma and spine surgeon at ALTY Orthopaedic Hospital, who will be sharing expert insights on how motion preservation techniques are changing the future of spine care. Stay with us because this is a conversation that you won't want to miss. Now let us all put our hands together and welcome Dr. Lim. Hi, Dr. Lim.
Hi, Fiona.
Dr. Lim, thank you for joining us today.
Yes, thank you. Thank you for the invitation.
Now, I know that a lot of people might be wondering, they have heard of, an orthopedic, but they don't really know what does an orthopedic consultant do at, their workplace. Maybe you can walk us through?
I think orthopedic surgeon, probably people know us as a bone fixer, right? We have a broken bone and we fix them, right? So, but some of us, we go study further to become subspecialized in, say, spine surgery. So now I'm mainly doing spine surgery now as orthopedic surgeon. All form of spine condition. That's what my practice right now.
Wow. Okay, as I mentioned earlier when I did my opening, I mentioned a phrase of, motion preservation. So what exactly is motion preservation spine surgery?
I think motion preservation spine surgery is an advancement in the field of spine surgery. In olden days, like when you talk about spine surgery, the surgeon just put some screw in your spine, lock it up, and that is not good, right? In olden days, people still continue to have back pain despite having surgery, right? So that nowadays, this motion preservation spine surgery aims to preserve the spinal motion even after you undergo the surgery, so that the function and the outcome is much better in terms of pain and also mobility. So that is what we meant by motion preservation spine surgery.
Okay, so maybe you can share with us also what are some of the examples of motion preservation spine surgeries that we have here.
I think some of the example is, say, nowadays we are moving towards the endoscopic spine surgery. That itself is a form of motion preservation, right? You use very small keyhole to address some of the spine pathology like slip disc, right? And then in more advanced cases, we do have now come out with the special implants like a disc replacement surgery. Just like people undergo knee replacement surgery, so we do have now disc replacement surgery. We can remove the damaged disc, the disc that is already stiff, right? And then we replace it with the artificial disc that can actually bring back the motion and give back the spinal motion that it was supposed to have, right? Our spine is meant to move, right? So restore the motion, right? So that is due. Actually can reduce the back pain and actually improve the functional outcome after this type of procedure.
Okay, so to be really honest with you, Dr. Lee, when the moment we heard about spine surgery, a lot of people, inclusive of myself, when I heard about this thing, we fear, about this, like spine surgery is something like really big because we think that it will limit our movement, it's very painful, and there's a lot of side effects, so on and so forth. So how accurate is that perception in this modern day? Can you share with us?
I think that's no longer true. People are fearful because I think it's from a past experience. Say 30 years ago, their parents or their grandparents may have undergone some spine surgery, 30 years ago, and after surgery they still continue to have back pain and some disability. So that fear now they see in their grandparents, and now because of that, they fear for the surgery. But that's no longer true. As more technology is evolving, and the surgery itself also evolving, we have a much better technology and better spinal implants. And so nowadays spine surgery is very safe. It's like the olden days when they hear about spine surgery, they think about, you have to stay in the hospital for like weeks or even months. But that's no longer true, right? We do like a spinal endoscopic surgery. You just stay overnight. Today, immediately after surgery, you can actually walk around, and the next day you go home. And nowadays, with advancement in technology and also advancement in surgical technique, that risk is definitely much lower now.
Okay, wow. Okay. So glad to hear that. So everyone that's watching this show, please bear in mind the fear and all those perception that you guys always have. It's actually from it's actually from the technology 30 to 40 years right now.
Yeah, exactly.
So now with all the modern technologies now here, we don't need to actually stay in the hospital for weeks or months. Like doctor mentioned earlier, we can actually go to the washroom after the surgery, after a few hours, right?
Yes. Once you're awake from the surgery and you're fully awake, you can get out from the bed and walk to the toilet. Initially, you may feel wobbly a bit, then you may need some form of walking aid, right? But as your recovery progresses, and you can actually walk quite normally within a few days with the surgery.
Okay. So now, spine issue is actually, for last time, people used to think that, okay, people that are, of certain age, then we will only get spine problem or these issues. But nowadays, we can actually see it's getting more and more common. It's not about age anymore. Like even people in their 30s and 40s also getting more spine issues. So why is that, doctor?
I think this is something have to do with the lifestyle, right? And also maybe due to their work, right? And also I think nowadays people are more active. They participate a lot in a lot of sports, right? So all this can actually cause injury, right? Especially if you're young, you play a lot of sport, you get some sport injury. And once you have the injury, that can quickly accelerate the damage, the degeneration in your spine, right? Other factors are like if you're doing desk job, right? Every day you using a computer device for your work, long hours, 8 hours a day, you are also at a high risk group to develop all this spine problem. And also I would think the other factors are nowadays people tends to be more overweight, right? When you're overweight, that also put a lot of stress in your spine, and that can actually accelerate the degeneration in your spine, resulting in earlier to get a back pain. And one of the biggest thing that I blame on is actually the use of handphone, right? Nowadays we see everybody looking down at their handphone all day long, they're tilting their neck in that position for long hours, right? So that is definitely not good for the neck. So I can tell you that we are operating more and more on people with neck problem and back problems. A lot of them are due to the long hour office work, right? And also their work nature, and some of them, especially a lot of them actually overweight who have this actually the low back issue. And because of the I think in the olden days, if the surgeon they don't like to offer surgery at the earlier stages because they don't have the good technology. So they would like wait until there's no conservative treatment doesn't help anymore, then only do surgery. But nowadays, we have the technology that we can restore even at the young patient, because by preserving the motion, we actually get them back to their previous activity level much quicker, and also can really improve their lifestyle and also their pain. Be surprised that could be the current technology. Whatever back pain that you have after surgery, it can almost completely be gone. Right? It can really take away the pain almost 100%.
I thought what Dr. Lim shared earlier, can convince those of you who are actually watching this show. If you face any sort of like spine and neck pain, please do go and check it out, because I would like to highlight again, the technology that we have is not like last time. Like Dr. Lim also explained that last time when they opt for or suggested surgery, it's only when the situation is like so thorough, then only the doctor will suggest surgery, because there's no a solution for treatment for the injury. But now with the modern technology, the earlier you go for treatment, the better it is, the faster you'll be able to actually recover. So maybe we can also share with our audiences today, Dr. Lim, what are the benefits of motion preservation spine surgery?
Yeah, I mean, one case is, right, if we know that when your spine starts to undergo damage, slowly your spine actually becoming stiffer, and the motion actually reduces. So then it becomes like a vicious cycle, right? When one level, so if you look at your spine, especially on low back, say there's a 5 level of joint movement. So imagine one of the joints is already stiff with the damage, right? So now only 4 level can move. So then eventually that 4 level have to do more work, right? And then eventually one by one, you will undergo the degeneration and become stiffer. So that's why we see a lot of people when they start to have back pain, after a few years, it's not the 1 level disease anymore. It becomes like 2 level, 3 level, right? So a lot of time when we see, when they come to seek for treatment, it's already quite an advanced stage that it's not just 1 level disease, but 3 level disease. So if we can catch them at the early stage by solving that 1 level problem, improve back the motion, that will reduce the risk of subsequent level getting into damage, right? So that's why we try to emphasize now, don't wait, right? If you have back pain, first when you have back pain, you come there, we don't immediately tell you need surgery, right? So if your pain is not too long, it's not too bad, you have to definitely try conservative treatment for 1 to 2 months. If you are indicated for this type of technology or the disc replacement, definitely we would want to offer you, so that by solving 1 level disease, you will end up without needing any further surgery in the future, right? If you wait too long, you may end up not just needing 1 level surgery, but you may end up needing 2 or 3 level surgery, which is a considerable bigger surgery compared to level 1 surgery.
Okay, so this is what people call early treatment is better than you wait until the end of the time when it worsen. Instead of later, you might need to do 2 to 3 surgeries. So now maybe doctor, you can share with us also, how does this motion preservation surgery helps the patient to maintain flexibility and return to the activities that they enjoy?
Yeah, so I mean, our spine is meant to move, right? So when you do any sort of sports or simple hiking or even running on a treadmill, cycling, you need your spine to move, right? So when your spine is stiff due to maybe previous surgery or due to some spinal condition, so when you try to do certain sport, then in that stiff spine, you're going to end up with a lot of pain, and that actually prevent you from doing exercises. And without exercises, it's like a cascade, then will help also kind of deteriorate your muscle bulk, also reduces, and that makes your back muscle weaker, and that actually kind of make everything going deteriorate from that point onward, right? So if we can restore back, get the motion of the spine, So the sooner you can get back to your exercise by the strengthening your back, and your previous exercise level, that will actually stop the progress from your the cascade that your spine from deteriorating from that point onward. So because your spine, you need muscles as well to support it, right? So once your spine is damaged, your muscle also become weaker, and everything just goes downhill after that, right? Then it's quite difficult to gain back whatever function we have. So the earlier we sort out the main joint issue, get back mobility, the sooner you can get back into the exercise by strengthening your muscle, and that will get back to your previous KPTV level. And actually our aim is to make you keep again, that you can participate in whatever sports that you once were very into.
Right. Well, when Doctor mentioned about people that usually go hiking, do a lot of sports, I begin to think about my future.
Yeah, I can tell you, right? Previously, when people think of spine surgery, after spine surgery, they think that that's it. I cannot do any more sports, right? I think that's what everybody thinks. So that's why they don't want to do a spine surgery. But it's no longer true, right? It's no longer true. We have patients, because of this spinal issue they have, because every time, some of them are actually marathon running, right? They used to run like half marathon, 20 kilometers, even full marathon, 40 kilometers. Because they develop this spine problem, they cannot, as soon as they run, they have pain, right? And they thought that they can never run again until they see us, and we offer them a solution like a simple spine surgery. And after the surgery, they were so happy that within like 3 months, they can go back to almost like half marathon, 10 kilometers, then followed by half marathon, and now they're so happy, and they've been telling their friends, and they've been referring patients to me, right? So this is something that we want to tell people, that they can actually, nowadays with our advancement technology, we can get people to their previous TPT level, right?
If only I get to meet Dr. Lim about 5 months ago, that would be great, because I have like my good friend is also a marathon runner, and because of the type of shoe, the wrong type of shoe that he wore, so he got like certain injury at his spine, and it was so bad that he couldn't run for a month, and he got depressed during that time, and was so worried, just like what we discussed earlier. He was worried on the surgery, whether after that he can still run, do things that he want to do. Now, so now that we know spine surgery is nothing for us to be afraid of, it's very easy, and we can like almost immediately return to our daily life. Maybe it's time for us to know, okay, so now I know, okay, this is how a spine surgery is. What are the process like? Can you walk us through from the consultation process until the surgery, and also what does the planning processes look like?
Yeah, so I think the first thing is we need to get a consultation with a qualified either orthopedic spine surgeon, or even I would say even neurosurgeon, right? Can assess your condition, right? And then typically we start with the history taking. We would like to know how long is your pain, and whether you have any numbness or weakness in your hand or feet, and also whether there's radiating pain down your hand or leg, right? So that will give us some idea whether there's involvement of your nerve. Because as we know, our spine doesn't just consist of bone and joint. It consists of a spinal cord and nerve, right, running down. But that is what gives us our hand and leg function, right? So after we get a detailed history, then typically we will do a detailed clinical examination to assess your neck motion, your spine, your lumbar spine motion, and also to check whether there's any what we call a neurological function, whether there's impairment in your nerve function, right? Then if you think there's a need, then we will do some imaging. Sometimes we start with X-ray, or if there's the need, we will do like MRI or even CT scan to look at all the nerve in your spine and the joint integrity of the joint in your spine, and whether there's any instability in your spine. So once we do all that, then we'll come out with the different options of treatment, right? So typically we will, nowadays, like I think in the olden days when surgeons talk about treatment for spine, they'll just tell you, oh, you just need to do this. There's no other treatment option. But I think that no longer holds true, right? All the treatment now is customized as to what the problem is, right? Some can be treated with just a simple, may not be even surgery. Sometimes you can solve it with just an injection, right? And sometimes you may need a minor surgery, people like a daycare procedure. And in those more serious cases, yeah, then you may end up making some more advanced procedure, right? So like, yeah, and if you are really suitable for this replacement, then we will offer you this treatment. Our aim is to get back to what they like to do before they get into this spine problem.
Okay, so after the surgery, you mentioned that your aim is to get the patient to, be able to do whatever they want or their hobby whatsoever as soon as possible. But maybe can you share with us what is the timeline or the duration so that people roughly have an idea?
So yeah, I think that also depends on the type of procedure we'll do for them, right? So for example, if you just do a simple like epidural injection, that's like there's no wait time immediately after injection. You can start exercises, physiotherapy. Normally we do recommend some light exercises in the beginning for first 1 month or so. Then as you get better, then you can slowly get back to a more strenuous activity, right? And your previous sports, right? And then, but if you happen to undergo surgery, typically immediately after surgery, you can walk, right? And for the first 2 weeks or so, you can actually perform some light activity, right? Walking around, some light walk in the garden, right? Then, and after about, normally full recovery you achieve in about 2 to 3 months time, right? After 3 months, typically with this style of procedure, you can go back to full activity, like whatever sport that you want to do.
Okay, so treatment or surgery is not magic. After treatment, after surgery, I believe we do also have to remember to take care of, our posture, adjust our lifestyle, like Dr. mentioned earlier. Now there's a lot of the current generation. I mean, almost everyone are using handphones, mobile phone. The head is always down looking at our mobile phones. So maybe doctor can share with everyone here, what are the habits or lifestyle changes you can actually recommend to ensure long-term spine health after a motion preservation procedure?
Yeah, I think this your posture habits is really very important, right? So for example, for handphone use, if I can demonstrate, right, instead of looking down, actually you raise your handphone right up, so that your spine is not tilted downward, right? So your spine is like upright, right? So and also I won't recommend prolonged use of your handphone, right? And if you're doing like desk job, computer work, then you really need to adjust especially if you're using laptop, you need to get a laptop stand or you raise it up, you maybe look down your laptop, right? And also the sitting posture, the way you sit, and actually you need somebody to observe you from the side when you're sitting. That means when you sit, you look at the ear, your shoulder, and your pelvis should be aligned, right? That is a good posture. And posture actually is not enough, right? You still need to take frequent breaks during your work, right? For example, we recommend every 30 minutes. Right? Every 30 minutes, you can get out, walk around, get a glass of water, or you can do those simple office stretching exercise, right? Just loosen up the joint, right? The rotation movement of the neck, the stretch out your neck, back, right? So those you should do it regularly. And when you're at home, you should perform other type of exercise, right? For example, your core strengthening, your back strengthening, even your abdominal muscle strengthening, like those plank. All those exercise actually is good for you when you're off your work, right? Then you should do it regularly, maybe 2 or 3 times a week, right? So these 3 things you should pay attention. One is your posture, right? Then don't remain in that position for too long. Every 30 minutes, change it. Second thing is regularly do a stretching exercise. As I say, your spine, because people, as you grow older or there's some damage in the spine. And the third thing is the strengthening of your spine, the muscle, like your neck, your core, your back, and also your abdominal muscle.
I remember used to last at the older generation, right? They like to use that purpose at this level. So now we know actually that is the correct posture.
Yeah, that is the correct way, correct use. Your children, you should also teach your children. I give talks to all this corporate, teaching their workers how to take care of their back. I always play a video that you should start this by teaching your children. Once you learn it, you should teach it to your children so that this should become a habit, right?
Yes.
You learn from the young, then it become a habit, and it's good, right? So yeah, so me, instead of using all those braces or mechanical device to help you sit better, I think habit is more important, right? So you don't need those expensive ergonomic chairs or table, but I think if you make it a habit, it's more than enough, right? To keep a good posture during your work.
Okay, so Dr. Lim, can you give one piece of advice to someone out there, I don't know who, but who has been living with back pain for years, but is afraid to seek for treatment?
So to me, I would to say that don't wait, right? Don't wait, right? So we know that if you have pain for too long, say for example, if your pain is more than 3 months, the pain can kind of register in your mind, right? So it became like a phantom pain. So even though we do the procedure and we do a good job by correcting it, sometimes the pain may not go away entirely, and it's not because of the spine issue. It's more like the pain has been there for too long, right? And then it doesn't go. It's just like you have some childhood trauma and sometimes you get nightmares about it. It's like registered in your mind, right? So nowadays, we don't want anybody giving pain for more than 3 months. So we like to get your pain resolved in 3 months period, right? So if you're getting some pain that lasts longer than 2 or 3 weeks, I advise you to go and seek treatment, right? You can actually see your general practitioner, right? If they see there's a need, they'll definitely refer you to come and see one of us, like orthopedic spine surgeon or even a neuro spine surgeon, and we can actually help you get back to whatever your previous activity level, and also try to remove whatever pain you have, right?
So for those of you who are suffering with spine or back pain, you can actually look for Dr. Lim at ALTY Orthopaedic Hospital. So maybe doctor can share, what are the advantages for, those who are suffering that can actually come and seek treatment from you at ALTY Orthopaedic Hospital.
I can say that we are the hospital in Malaysia, only hospital that perform the most disc replacement surgery in Malaysia. That not many surgeons do this type provide this type of service, like this type of procedure. So I would say that you should come to us, right? If you for a second opinion, like say you go some surgeon offer you fusion type of surgery, putting screw in your spine, I think you should come to us for a second opinion, right? So if you feel that you can do this replacement surgery for you, that will be better compared to just putting screw and fusing your spine, right? So you know that when you put a screw locking up your spine, you will end up with some other problem a few years down the line, right? So I will not say that all spine condition we can do this replacement surgery, right? So, but we will need to assess you, right? If we think you are indicated for that, definitely we will offer it to you in ALTY Orthopaedic Hospital.
All right, Dr. Lim, before we end today's show, maybe you can, share a key message to our audiences today.
Yeah, so I know a lot of people are suffering from a neck pain or back pain in silence, right? They are afraid to seek treatment. They may think that if after undergoing any spine surgery, that's it, their life is done. They cannot do any more sport, but that is not true, right? Our aim is to help you get back on your feet, to help you get back to the activity level, and we can do that by restoring your spinal motion with this type of spine preservation, motion preservation surgery, right? That can really get back to your feet. We have the technology, and so wait to seek treatment.
A big thank you to Dr. Lim Sze Wei for sharing his valuable expertise and showing us how innovation is truly transforming patients' life. Now, thank you.
Can I add something like, so even now, this motion preservation surgery, we can even offer to young children who have a scoliosis. Scoliosis, right? No, I think nowadays people think scoliosis means you definitely have to put screws and rods and lock it up your spine to straighten it up. But now that's no longer true, right? We already start to have this procedure we call vertebral body tethering. So we just do this surgery, putting a screw and with a cable like like a cord in your spine, and you still preserve your spinal motion without doing it, without needing to fuse your spine, right? And there are also other technology that is going to come in soon, right? For example, like facet joint replacement or even the spine. So I think it's very exciting for the next 2-3 years that a lot of evolving technology that's coming in, right? So I will say don't wait. You can please come and see us, and we can help you from there.
All right, now Chinese, there's a saying, don't become your own doctor. So let the doctor be the doctor for you. If you suspect anything or you are uncomfortable, please go and seek help, the proper professional help. So in this case, please go and see Dr. Lim at ALTY Orthopaedic Hospital. Now, to our viewers, if you are experiencing persistent back or neck pain, please, again, I would like to remind you, do not ignore the signs. Early diagnosis and the right treatment, or speak to a specialist, visit ALTY Orthopaedic Hospital and take the first step towards better spine health. All right. Now, this has been Health Matters. I'm your host, wishing you a healthier, more active life. Until next time, stay well and keep